Well, our big focus today is on the vaccination drive and the next drive, the next phase, which is going to begin from the 1st of March. Or this phase will be for all citizens above 60 years of age and those over 45 years with comorbidities. Now, this phase importantly will rope in private hospitals in a big way to help with the vaccine drive. This is very important because the country needs to speed up the vaccine drive that has not been as fast as we would have expected or liked it to be. Remember, 3 crore people were meant to be vaccinated in the first phases, which includes healthcare workers and frontline workers, and then the rest 27 crore in the next phase by the summer. So far, India has vaccinated around 1.34 crore people, which is about 1% of the population. Well, we're still waiting for more details from the government regarding what will take place on March 1st. But to talk more about the vaccine drive so far, we're joined by Professor K. Srinath Reddy, President of Public Health Foundation of India. Thank you so much, sir, for speaking to us here at NDTV. Once again, what would you say about the vaccine drive so far? There have been concerns about it having been too slow. What are your views?
Well, I think when it started off, there were going to be some concerns about how best the technology can be rolled out. But since it was mainly intended in the initial stages for the healthcare workers and then for other categories of essential workers, the glitches could be detected and corrected in time. The real challenge will come when it's now rolling out to the general population, particularly those who are 45 years and above or those with comorbidities. That's going to be a large number. But it appears that the glitches have been corrected and multiple channels for registration have now been opened up, not only through the Arogya Setu app or even directly through the CoWIN app, but also possibilities of registering even otherwise, including walk-in registrations. So I think the technical part of it is getting sorted out. The partnerships are being forged with the private sector as well coming in, and 20,000 private sector centers being now made available for vaccination. But clearly we have to ensure that the flow of the vaccines to each of these locations is uninterrupted, and that people who are registered or even otherwise willing to walk in and get the vaccination are encouraged to do so, overcoming any vaccine hesitancy, and that all eligible people are able to access without any major obstacle.
Right, absolutely, and a very welcome step to involve private hospitals in this next phase, you know, when we're opening the door even wider and allowing so many more people, you know, in the category to get vaccinated. Any concerns that you have? What do you think needs to be looked at very carefully before this phase?
Well, as far as the private sector is concerned, if the vaccine supply is coming in from the government, yes, and they are scrupulously observing the criteria that have been laid out for prioritization, and if the registration itself is directing the patients to different centers based on those priority criteria, then there should be not much scope for any deviations. Of course, some of the walk-ins can possibly be problematic, but even there, I think we should actually ensure that the right people are vaccinated and that we do not see any diversion. But the main thing is overcoming some of the vaccine hesitation that exists while trying to stem the vaccine urgency that some others who are not immediately eligible wanting to rush in and get vaccinated. Both those are important endeavors that we actually require much better communication and building up vaccine confidence among the people, not only through mass media, which are important, but through local community networks. The other thing that we must ensure is that the poor people and others who do not have access to smartphone technology or are not very clear about how best to get vaccinated, but are still vulnerable, are assisted in doing so. And we should depend upon local community networks and NGOs. And it's not just the private sector that should be brought in on the supply side. On the demand side, community networks and community-based organizations also should be brought in.
Right. In fact, you know, we spoke to some of the authorities and they spoke about how from one phone you'll be allowed to book at least 4 appointments, which means that, again, this point that you were making, that this will really test our healthcare system because it's going to open up a lot in the rural areas, in small towns, for the elderly, as you pointed out, not very tech savvy perhaps, and therefore a lot of assistance will be required because we can't let technology get in the way of, you know, vaccinating as many as we can as fast as we can.
Absolutely. And I also believe that while some sort of an identification verification is required,
Sure.
that should not become a barrier either for poor people who are not able to produce papers immediately, or even for people who may not necessarily have citizenship papers, because the virus doesn't ask you for your identification paper.
Right. And Professor, do you also feel that given now that we're seeing COVID cases rising again, the graph is going up in several states, and that's a big concern. Do you think that with it in the next phase that we need to concentrate on these states rather than the states, that are seeing lower cases of coronavirus? Now, if we take you through the next phase, as we said, it's for over 60-year-olds and over 45-year-olds with comorbidities. Professor Reddy, I was just asking that, do you think we need to now concentrate on the states that are showing a rise in the number of cases?
Well, let's recognize that the prime purpose of the vaccine is to protect against severe infection and death. Therefore, the vulnerable people anywhere need to be identified and protected. But certainly, since the risk is much more increased in the hotspots, we should now definitely go in for a saturation immunization program in those places and ensure that they get as much coverage as possible, particularly for the vulnerable sections.
All right. And your concerns regarding the fact that the cases are now going up, because we had these months of January and February when the cases were extremely low. However, a vaccine drive wasn't as fast. But now again, cases are rising. So we really have to get ahead of the virus and, of course, the fear of variants that are causing havoc in other countries.
Absolutely. Even as we are trying to contain the transmission, which we must. And remember, we should not only depend on the vaccine alone for containing the transmission. All the COVID appropriate behaviors are absolutely important. But at the same time, if we can actually reduce the transmission rates through effective immunization, that's going to be a great help. So it's a combination of multiple public health measures and vaccination type of interventions, which are providing individual protection, which need to be combined if we have to go about it.
And are you hopeful that we'll have more vaccines soon? Currently, we have 2 vaccines, Covaxin and Covishield, but there's news that the Sputnik vaccine from Russia, we may have it soon. So are you hopeful we'll get more vaccines and, it'll be better in combating the pandemic?
Yes, indeed. There are at least 6 vaccines which are now in the pipeline in India itself in terms of manufacture, and which have a diversity of platforms. Without anticipating what the regulator will do, if they turn out to be effective and safe, I believe within the next 3-4 months, we should be seeing at least 2 vaccines, if not more, qualifying. And certainly the Sputnik vaccine is now awaiting a further review by the regulator. But then there are other vaccines also which are knocking on the door of the regulator. And by about June, we should be able to see possibly more.
All right, Professor Srinath Reddy, thank you so much for speaking to us once again on the show.
Thank you.
Well, we were just talking about variants, and now there's news of yet another variant having been identified, a new coronavirus variant that shares some similarities with the more transmissible variant that was discovered in South Africa, is on the rise in New York City. This according to researchers at the Columbia University Vagelos College. Now, the new variant, which is called B1.526, was first identified in samples collected in New York in November, and then by mid-February, according to the study, it's representing about 12% of cases there. And however, we must point out the study has not been peer-reviewed. To talk more about this, we're now joined by Dr. Swapnil Parekh, internal medicine consultant and author of the book, The Coronavirus. Thank you so much, Doctor, for joining us again. And, we keep hearing about these new variants, and it's quite alarming. But again and again, new scientists and researchers have spoken about how this is something that's expected. There will be mutations, there will be variants.
Gargi, thank you so much for having me on your show. Everyone wants their own private scariant. I call these SARS-CoV-2 scary variants, more transmissible, more lethal than all the rest, upon which to blame the increase in cases and increase in deaths. Variants are of course concerning and important, but so is human behavior, and so are proven evidence-based public health intervention. Pandemics can be as much a force of nature as earthquakes. But unlike seismic waves, pandemic waves are driven by human behavior, which at least in theory ought to be in our control. So the B1526 variant identified the lineage in New York. One group has the S477N mutation, which is thought to enable it to bind better with our receptors, infect us better. And there's another mutation, the E484K, which is thought to provide immune escape. It's able to beat certain antibodies. And this has been identified in multiple parts of the world where there has been a high level of population immunity. So in UK, South America, Brazil, South Africa, in New York City. So we're starting to see what's called convergent evolution. So the virus is starting to evolve to be able, we think, to partially escape our immune response. And as long as transmission stays up, we're going to start seeing, we're giving the virus more opportunities to evolve. So of course we need to be concerned about variants, but also our own behavior.
Right, and that's why we need to, quicken the vaccine drive. And what do we know about in India so far? Because, there were a lot of concerns when we had those. We have some of the cases that have been identified from the UK, but many suspect there are probably many more cases of, the variant which is identified in the United Kingdom. And but so far, and people even questioning whether the numbers that are going up now, especially like in Maharashtra that we're seeing, that it could be blamed on these variants?
It could be. But I think it's also our behavior. Ultimately, whether it's the prototype SARS-CoV-2 or OG SARS-CoV-2 as some call it, or the variants of concern, the same public health interventions work. We might have to be more compliant with them, but they work. So in Maharashtra, we've also started in some cities to open up trains. There's increased social contact. And I think we're going to start to see this across the country. Maybe Maharashtra is doing a better job picking up the spread right now, but I think this is going to be a problem we have to contend with across the country.
And what steps, we're already seeing that the Chief Minister has called for meetings, a lot of discussions going on. Now, from the 1st of March, there will be the next phase of the vaccinations, and that is something that, will hopefully be, it'll be quickened, the entire vaccination process, so we can reach out to more and more people. So Maharashtra specifically remains a big concern. It was the state with the largest number of cases initially, and now again, it's been reporting over 8,000 new cases over the last 2 days, and that's after a gap of around 3 months.
Maharashtra has several large cities, densely populated cities. So we do have a lot of risk here as we begin to open up. I believe we're going to start seeing this in other places as well. What we really need to do is, like you pointed out, scale vaccinations. And specifically in those areas where we're starting to see increased transmission. So this is like providing ring immunity to that area, preventing spread. We specifically also need to protect the immunocompromised individuals, because what we are seeing is that in immunocompromised people, the virus can keep replicating for a long time and evolve very quickly. So maybe we need to identify these individuals, prioritize them for vaccination, and keep them safe. But of course, we also need to start rolling out the other vaccines that can potentially stop transmission, like the nasal vaccines, Covovax. So there's a lot we can do and a lot we need to do.
All right, Dr. Swapnil Parekh, thank you so much for speaking to us here at NDTV. Well, with that, time for us to slip into a short break. On the other side, we'll get you some of the international stories on the pandemic. Stay with us. Welcome back. Well, it's time now for a viewer question segment on the show, and Dr. Swapnil Parekh back with us to take those questions. Let's listen into the first one.
I want to ask a question that which of the following mask is the better to fight against COVID-19? Cloth mask, surgical or N95?
All right, about the masks, and this is something that many people have been discussing about, which masks are the best.
The N95 is the best in terms of the protection towards you, but equally important is how you use it. So as important as the type of mask is how well it fits, how well you wear it, how consistently you wear it. So while N95 are the best, any triple mask that tightly, better than nothing.
Right, and people even talking about double masking these days. Let's listen in now to the next question.
I have one question to ask. There are news of strains and mutations coming. Will Covishield and Covaxin be effective in these cases?
Okay, so will the vaccines that we have in India, Covaxin and Covishield, be effective against these new variants?
All available so far suggests that there is a slight decrease in the neutralization potential due to these variants. However, we hope that we will have evidence to show that these vaccines protect against severe disease, hospitalization, death. Let's keep in mind, we all take influenza vaccines. People in risk group take them pretty often. So right now we should focus on, is it going to protect us through the pandemic? It will save your life. It will keep you out of hospital. We may need to update them in the future, but that's a question for later. Right now it will protect.
All right. Thank you so much, Dr. Parekh, for joining us.